Doctors of Reddit, what is your most awkward experience when dealing with members of the opposite sex? NSFW. We are taught to explain to patients exactly what we are doing, as we are doing it. Delicate wording becomes important during female pelvic exams. Instead of "okay, I am going to place the speculum inside now, so you'll just feel some warm pressure," my buddy ended up saying "okay, I'm coming inside you now." The female patient responds, "No thanks, I already have 3 children." My granduncle is a urologist and I got a boner from checking out one of his nurses when I was around 12. I then had to explain why I couldn't drop my trousers for an examination. He asked if I wanted to go to the bathroom to do something about that so we can continue the examination. I had no idea what masturbation was and he explained rather vaguely to me the gist of the operation. I didn't feel like trying it so we just sort of waited until it went away. I don't know if it was awkward for him, but whenever I think about it I cringe myself into the fetal position until I can block it again. My classmate and I were at a free clinic performing our first ever pelvic exams on standardized patients. Classmate is a big woman pillager of a man and gets to go first. He proceeds to insert his fingers to palpate for the manual exam. Our poor standardized patient shrieks right away. She promptly states that for all women's sake, he is gonna need to use one finger for those procedures from now on. Doctor here. Recently walked in on a new mother in a sitz bath with 2 breasts pumps gulping away at her all the while her husband grins from ear to ear as I worked her up for a pubic bone injury. The newborn could sense my embarrassment. If it makes you feel any better, when I had my son, I couldn't have cared less if Macy's Thanksgiving Day parade trooped through my room. All sense of modesty went right out the door and I cared fuck all who saw what part of me during my time in the hospital. If you were there to help me, have at it. And thanks for all you do, Doc. We appreciate it. Posted about 2 years ago on a similar thread. 3rd year of medical school on my family medicine rotation which I'm doing on my med school's campus academic health center. Electronic medical record shows 24-year-old with chief complaint of cough, so I go in to interview her where it comes to light she's really there for vaginal itching. Finish up the interview and tell her I'm going to grab my attending for the pelvic exam. My attending tells me she'll let me do the pelvic if the patient consents. I had already done obgyn at this point and was quite comfortable with it, but we both agree I'd likely get asked to leave the room altogether. Lo and behold, patient consents. I do the pelvic, we write her a script for some antifungals and she goes home. 2 days later, I'm teaching a small group of first year students how to perform an abdominal physical exam. Teaching is a requirement of the family medicine rotation, when, during introductions, I come face to face with my patient who never mentioned she was a first year student. We both played off really cool at first, but during the session, her partner asks me to show him how to do an inguinal femoral hernia examination on a female patient, aka his partner. While I'm doing my exam, she breaks out in hysterical laughter which causes me to lose it and start laughing at the absurdity of the situation as well. She played it off like she was ticklish and I said something stupid like I thought of something funny, don't mind me. 2 weeks later, she returns to the clinic for a follow-up and I go see her. We talk for a while about how she's feeling, how awkward our second meeting was, and then just shoot the shit for a bit when she goes, "So when are you going to take me out to dinner?" I politely declined and explained I had a girlfriend at the time and never saw her again. TL. Doctor, I did a pelvic exam on a girl who ended up being a fellow medical student, though 2 years behind me, and asked me on a date at her follow-up appointment. My perspective may be off the scope of the thread since I'm a veterinarian, not an MD. In my experience, people who do not want to neuter their male dogs are always males. Having a frank discussion about the benefits of neutering with someone who is emotionally attached to their dog's testicles is pretty awkward. Being a resident in Saudi Arabia, there are huge stigma attached to male attendings examining female patients, especially those with gynecological issues. Also, being a foreigner residing here, some customs and practices catch me completely off guard at times. That being said, I was once in charge of my consultant's OPD during OBGYN rotation, said consultant having left early thinking all major cases and appointments had been dealt with, and left me to clean up any stragglers in the last hour. In walks a 40-ish-year-old mother with her 18-year-old daughter, both completely covered from head to toe in burqas, who then proceeds to throw a tantrum about how the consultant wasn't there for her appointment, and how she left a male resident in charge of the OPD. A cursory examination of the daughter's file didn't reveal any history which would have helped me decide if my superior should get involved. I then began to try to talk her down, asking her what her appointment was about, and how I was in charge of the department. I didn't dare reveal I was just a lowly resident, and I would do everything in my power to help her out with any issues her daughter had been having. After a lengthy conversation I find out that the daughter was there for virginity verification because she was to be engaged and subsequently married off that month, and appointments in my hospital's OPD are a bitch to get, and they needed to present that certificate along with some others, regarding finances, genealogy and a few others, to the prospective groom during the engagement ceremony. I went completely numb, detached, examined the poor girl silently. She was in the stirrups naked from the waist down and burqa above that, not even an eye slit, and discovered, for the first time, a stack of thick, extremely official looking certificates in a desk drawer, to be given to women who pass the examination. I have since performed that examination close to 30 times, and have seen quite a few females who didn't have an intact hymen, and actually sobbed quietly in shame during the examination. I try to explain to the family that hymen rupture is in no way a sign of promiscuity or even sexual penetration. To those people I know wouldn't understand, I just certify their daughter's virginities and tell the girl to come up with an excuse later on to their families. I was the chaperoning nurse, young doc, first week in OB and was seeing early pregnancy PT in Tridge. Docs usually say I'm going to put my hand on your vagina now, or you will feel the speculum on your lips labia. He was rattled and so nervous he conflagrated them as I'm going to put my lips on your vagina now. The patient and I roared with laughter for a second before we controlled ourselves. He shakily kept his dignity and kept right on going like nothing happened. He never referred to it again for the 4 years he was there. General Surgeon, 31/F. For context, I work for a county hospital taking care of very salt-of-the-earth patients. These are my people, as I was also born with a plastic spork in my mouth. Talking one morning to a young man who was about to get his inguinal hernia fixed, and his only question to me was, "When can I have sex again?" The only person with him was his girlfriend, who was smoking hot, so I broke him the bad news. You're gonna wake up feeling like a horse kicked you right square in the junk. So, go ahead and do what you want when you feel like you want to, but it's not gonna be today. We get him to the OR, put him under general anesthesia, and then a very new, very young, very pretty female nurse starts to prep him. To those unfamiliar, this involves vigorously scrubbing down the groin, including the penis and scrotum, with what amounts to a sponge on a hollow stick that dispenses a compound that decontaminates the skin somewhat. As soon as she starts scrubbing, the patient pops a raging boner. He's completely under and paralyzed, mind you, but the more she cleans, the bigger it gets, and yeah, this kid's a shower, I tell ya what. Poor thing, her face just gets redder and redder, and it gets bigger and bigger. And everyone's giving her shit the whole time. I finally stop her because I'm afraid any second he's gonna break scrub and contaminate my field. We do our best to drape around Olron Jeremy, it was hard. My poor, married with kids and straight as far as I know, male resident had to keep batting the damn thing out of our field during the whole case. Afterwards, I made sure to reiterate to the hot girlfriend that he probably wouldn't feel like having sex in the near future. She asked me point blank if it was okay if she blew him, and I told her to go nuts. He asked me the same question when he woke up from anesthesia, and when I gave him the same answer, he gave me a knuckle bump in reply. God, I love county folk. Patient here. I was in a small town where my parents used to live and I had to see a gynecologist. I was worried that I may have had a tampon stuck in my vagina. That's not physically possible, but I didn't know that at the time. Unfortunately, the only doctor I could see was a friend of my parents. After thoroughly probing and peeking, he informed me that there was nothing wrong. In fact, your vagina is, for lack of a better word, gorgeous. I've never been so embarrassed. I had to babysit his kids that weekend. TLDR. Dad's friend tells me I've got a beautiful beaver and then I have to babysit his kids. I had one patient who had made her desire for me very public, but since I treated her entire family, I decided not to kick her out and continue to remain professional. In the midst of a bipolar she kept complaining of female issues. During her pelvic exam, I happened to look up and I saw a gigantic smile on her face. After the exam, in the hallway in front of a few residents, she said, "If you weren't my doctor, I'd fuck your brains out." Perhaps I should have mentioned this earlier, but she was the only woman I've ever met who is a 0/10. She's the only patient who made me question my heterosexuality. Somewhat related, but from a patient's perspective. When I was in nursing school, I went to my school's student health center for a gyno appointment. The doctor asked me if it was alright if a medical student was present. I said that was fine. She then specifies the student was male and asks me if that was still okay. I wasn't totally comfortable with that, but as a nursing student I knew how much it sucks when a patient refuses you, so I said yes. Lo and behold, it was an incredibly attractive med student from my school who I bumped into all the time, and he saw the inside of my vagina. I never could look him in the eye after that. Edit. A lot of people are commenting that he or I should have refused. I didn't actually know the guy, I just knew him as a hot stranger. And I think I became much more aware of his presence after this occurred. After receiving an internal exam from my gyn, he asked if he could bring a medical student in so they could get some practice. I agreed, thinking he meant a student. He took a good 10 minutes, but after that, in walked a group of about 5 people, male and female. They each took turns putting their fingers in my vagina, then talking about me like I wasn't there as they reported what they felt to my gyn: syphilitic chamka? Cystocele? Full stop. With his back turned to me, my gyn corrected them and told them exactly what they had been feeling. It's her penis, attached to the interior wall below the cervix. Her urethra is inside her vagina. She was born with ambiguous genitalia and had cosmetic feminization at 2 years of age, but the surgeon missed the internal structures. And that's how I discovered that I was born into 6 and my parents opted for me to have labiaplasty as a toddler. Edit. Lots of people are asking, so here are some common answers. I identify as female and in the end the surgery was the right choice. My father made the choice he felt was right for me at the time, and while I'm annoyed, I understand that as a single guy with his first child, he did what he thought was best. I had the penile tissue removed a few months afterwards and had the urethra moved closer down, and had other bits and bobs adjusted. I'm not annoyed that the doctors spoke like I wasn't there, that's how it works, and I was fine with that. I was just shocked to find out about my condition in that way. For those asking what it's like or how I didn't know, the initial surgery was clearly well done. I had no idea that I was different other than never being able to find my pee hole. I felt a lump inside and thought it was just my cervix, so it was never something that bothered me. My first boyfriend also noticed the lump, but we never thought it was anything other than a random lump. I am completely female in every way. I do not lack a single female organ or feature. This condition does not affect reproduction. I have a clitoris. In fact, the penis is likely just part of overdeveloped macroclitoris that extended into the vaginal canal and affected the placement of the urethra. When I was 16, I sometimes got dizzy if I stood up really fast. I'm pretty sure this is relatively normal, but my mom thought something was wrong with me. So she took me to the doctor, and he wanted to check for testicular cancer. I had a worried look on my face because I didn't want an old Asian man feeling my nuts. The doctor saw my face and thought it might console me if he spoke teenager. He said in his Asian accent, "I'm gonna feel up your balls." I felt pretty awkward after that. Not a doctor, but I did have a doctor who was really funny and a bit weird when I was a teenager. When I was 16 I went on birth control because I had my first serious boyfriend, and my mom and I discussed it and wanted me to be safe. In order to get on the pill, I had to have my first pap done to make sure everything was normal first. The doctor and I talked about guys and sex, then school, then fashion. He asked me if I dyed my hair, so I said, no, this is my natural hair color. He then said, well, you know I'll find out if you're not telling me the truth when I get down there. Probably the most awkward doctor interaction I've had in my life. I laugh about it now, but as a 16-year-old virgin I was pretty mortified. Thanks for watching, and don't forget to like and subscribe.